Who are the best targets? Well, let's start talking about them right now. Okay, so who are the best targets? Well, literally, some of the best targets for referrals are going to be your discharge planners at hospitals. These are the people that you want to be able to link up. Now, it's a lot harder to be able to get into the hospital system, but that does not mean it is not possible. It's just going to take a lot of follow-ups. And I'll discuss with that to you guys a little bit later on further. Don't forget the physician offices. Look, you have your physicians taking care of patients that are in the hospital. And then at the same time as you're going to be dealing with physicians who are taking care of people at nursing homes. You also have the primary care physicians who have their offices where they have patients that are visiting them. So you have a large flow of patients coming from these locations. So you definitely want to be able to have a plan on how to market to these particular facilities. Rehab centers. These are like your CNCs, your continuing, services, or your nursing homes pretty much, or your rehabilitation centers, also known as rehab centers. So typically in a rehab center, there's two sections. You have your long-term and you have your short-term. The short-term area are those Medicare patients or Medicare Advantage patients or even some private insurances where they are not able to go directly to home from the hospital. So normally they will be in the nursing home or the rehab center for a small amount of time because they still need some assistance. But even once they have actually used up their time at this rehab center, they're eventually going to have to go home because their insurances, like Medicare, is not going to cover them there to be there entirely for a long period of time. So when they go home, which these facilities will always have discharges, especially if they're a larger facility, you're looking at about sometime in an average of about 3 to about 10 discharges on a weekly basis, depending on how large they are. So your rehab centers are a lot easier to get into rather than the hospitals. So you want to be able to concentrate majority of your time on your marketing for the home health services, for your medical home health services to the physician offices and also to the rehab centers. These are some of the best targets that you have. Also talk about hospice providers as well. If you are, let's say, a medical home health agency, there are times where hospice patients graduates from their services where they actually are not needing any more hospice services but may need home health medical services where they get downgraded from hospice care. Also, if you are a home care agency, the hospice companies will typically need assistance from home care agencies because they cannot provide all the clinical or all the clinicians for those particular patients that are going to be needing 24-hour care, that's going to be needing 12-hour services. So it's a very good source for both home care and home health services. I talked about the rehab centers, but the skilled nursing facilities are also considered rehab centers. There are some skilled nursing facilities that don't have rehab sections on them. So you want to be able to look at both locations. You also have Medicare agencies. So this is for non-medical private duty companies. So what's going to happen is this. When you are actually a non-Medicare home care agency, you should be able to link up with home health agencies that are medical. Because at times is for the medical home health agencies, they can only send nurses, therapists at a short period of time for 1-hour visits 1 to 2 times a week. There are going to be some patients that may need 24-hour care, and they most of the time the medical home health agencies do not have non-medical private duty. For some reason, they look at this as something that they're not interested in. There's very few of them that actually offer both. And for you non-medical home care companies, be happy about it because they this is a good section, a good source for you to be able to get more clients. Now, if you are a medical approved home health agency, I would consider making sure that you go ahead and bring in a private duty section of your organization. You can go ahead and create it as a separate entity. Make sure that there are separate people working on the locations, because you don't want them to mix their ideas up together. You want to be able to create that separation between both agencies. But at the same time, as you want to be able to utilize and start offering these type of services as well. Later on, I will also discuss great sources for private duty referrals as we go along with this presentation. So here is a good question. If you cannot answer any of these, then it's going to be hard. Do you know how to help them? Do you have an inroad? Do you know what makes their jobs easier? What ways are your services benefiting to them? Why would they just have to know about your agency? You need to be able to answer these questions, because what your job is as a home health agency, as a home care company, is not to provide services. You're here to solve problems. Our business is solving problems, whether the problem of patients having to be readmitted back to the hospitals, that being a problem and we can actually solve it by reducing that, or the problem of physicians not being able to find a great home care company, you're going to solve that problem. Maybe the physician doesn't like how other home health agencies are communicating with them. Can you provide better communication? So do you know how to help them with their problems? Do you have an inroad, a way to be able to access them to get there? Do you know what makes their job easier? We're going to talk about later on about CPOs, also known as care plan oversights for physicians. Can you help them with those? What ways are your services benefiting them? Look, you have to look at it as that any of your services is benefiting them because you're caring for their clients. So you need to be able to look at these questions, write it down, and for each great potential referral source, like we talked a few slides back, to be able to list down 4 to 5 problems that you can solve for them. By doing this, you want to go ahead and create your presentation around those problems. So understand this, we are in the business of solving problems, not creating problems, solving problems, not just providing services.